Dear colleagues, clinicians, doctors and PG aspirants, welcome to the video. I am Dr.Shyam Sundar from NIMHANS, Bangalore. Today I'd like to talk to you about healthy coping after failure in PG entrance examinations. Recently the INI set got over. Some of you might have qualified the exams. Some of you might not have qualified the exams. Some of you might have your friends or study partners securing good marks, and some of you might still be finding it difficult to secure a good rank in the exams. This video is all about exploring into healthy ways of coping with failure in the exams. Since our time of plus 2, we have been told a lot of myths. So just do hard work in plus 2 and join MBBS. Your life is set. Then once you enter MBBS, another mountain awaits you. You secure a PG seat in a good institute, then your life is set. So, but unfortunately, that is not the case with life of a doctor. The ultimate goal of a doctor is to become a good clinician. It is said there is no end to the art of clinical diagnosis. One can always be a better diagnostician. So after MBBS, often we are being tricked by general idea that you should do a PG, otherwise there is no life at all. But it's not really true. PG, super specialty, all these are some means of becoming a clinician. There are various other pathways to become a good clinician, to become a successful practitioner. In this picture, I have mentioned a few of them, like MRCP, MRCGP, working as the duty medical officer in any hospital. There are a lot of fellowships offered by IMA, Varsity, Apollo, Max hospitals, etc. in diabetology, emergency medicine, family medicine, and a lot more. There is a course called IDCCM, which is a course in critical care medicine offered by various institutes. It's a 2-year course after MBBS. You can also choose to work under a senior clinician, like a doctor who is a specialist in a particular field, to learn skills and knowledge. So there are a lot of ways to be a successful medical practitioner without PG and super specialty. Please keep in mind that PG and super specialty are just a part of a doctor's life, and they are not life. All right. So we joined a course in PG coaching institute like DAMS, Speed, and a lot other institutes. We get materials, we read religiously, we take notes, but exams and the results of exams depend on a lot of factors. Hard work, as well as luck, as well as your mindset during the exam, your situation during the exam, the support that you get from your family, your friends, everything affects the result of the exams. So whenever we fail in the exams, we often get frustrated by it because we have spent a lot of time preparing for it, a lot of time anticipating it, and this frustration gradually gets into our heart unless we try to dissipate it in a healthy way. And this frustration can lead on to negative thoughts about yourself. We start getting into a lot of cognitive errors, like we often tend to think we are useless, life has no meaning, etc., etc. Especially when we see our fellow classmates, qualifying in the exams and moving on with their lives, we often feel frustrated and often get into these negative thoughts. Unless these negative thoughts are managed appropriately through positive coping mechanisms, we might land up in depressive disorder. So it is always good to prevent the progression of frustration into negative thoughts and depression. How do we do that? Using healthy coping strategies, which is exactly what I'm going to tell you about. Once we fail, there are a lot of thoughts running in our mind. We may not feel like breathing. We might go into a train of thoughts, which ultimately result in frustration. So after failure, take a break. Okay, go to your hometown or visit your friend who's not a medico. Some people find spirituality to be helpful. So whichever makes you, recharge yourself, choose that. Take a break. Go there. Go to them. Talk. Some people find writing a diary to be useful. The basic idea is you should reflect on yourself, on the journey that you have taken. Right? Becoming a doctor is not easy. If you have qualified your MBBS exam with a pass mark, and if you finish your internship, you are already, a physician, right? So many a times when we are failing in the exams, we often tend to forget all our achievements. We often underestimate our achievements and overestimate our failures, right? So take a break. It helps in a lot of ways. Do something called behavioral activation. Behavioral activation is it's a process in which you need to engage in certain activities that will make you feel happy. Simple activities. It could be as easy as cleaning your room, getting some plants for yourself and watering them, writing a diary, going for a walk, spending time with your pet. So whatever makes you feel happy, with some simple effort, you can do that. That will give you a sense of accomplishment. So plan such kind of activities and do it. And engage in positive behaviors. Positive behaviors are, let me enlist some of the positive behaviors. That was a lot. There is something called positive self-talk. Many achievers used to do this positive self-talking, in which they say certain sentences or phrases to themselves, positive sentences and phrases to themselves, by looking at a mirror, standing in front of a mirror and saying, encouraging yourself. It's ultimately, by the end of the day, it is always you who will be standing for yourself. Engage in positive self-talk. Spend time meditating if you are comfortable with that. Sleep. Maintain your sleep routine. Don't let technology and screen time steal your sleeping time. Choose healthy foods. Many people have the tendency to go on to stress eat. Some people, to counter their anxiety, tend to take more caffeine, which paradoxically worsens the anxiety after a particular point of time. Some people resort to smoking, alcohol, which again harms the body and further worsens anxiety and depression. Don't engage in such behaviors. Choose healthy food. Have greens. have salads, enjoy the process, connect with people who are not related to, medicine, connect with your school friends, connect with your family friends. Just see how their world looks like. It is often after a failure in an exam, it may appear like everything is, belittling you. Don't give room to that. Engage in talk. Then you will understand how much hardships people are undergoing in their parts of life, and how lucky we are to be doctors. Few other positive behaviors are, if you are good in some art, some people are good in painting, some people are good in singing, some people are good in playing musical instruments, whichever makes you feel happy, do that. Engage in that behavior. So you've taken a break, you have done some behavioral activation, you have done some positive behaviors, then what to do? You should decide. You should decide on what you're going to do next, whether you're going to prepare for the next exam, the NEET is coming up, or whether you are want to choose some other pathway, like you want to work for some time, you want to work and prepare parallelly, or you just want to work, you want to do a fellowship. You should decide. To decide that, there are 3 steps. First, reorient yourself. Forget all your past failures. There might have been certain blunders and mistakes that you would have committed on the way. Forget all those things, because you're going to approach a fresh exam or fresh career, whichever that is. So reorient yourself. Just disconnect yourself from the past. Don't feel guilty about anything. Start fresh. So reorient yourself to what you're going to do, what do you want next. Reset your brain, like whichever decision you make. For example, you want to do NEET next, so reset your brain so that you are ready to take up that task. If you want to do, for example, work as a duty medical officer, reset your brain that way, right? Then analyze. As you start your journey towards that particular destination, analyze yourself. Do self-analysis. For example, after a week, have a plan for a week. And after a week, just analyze yourself, how much you were able to do in that week. Keep monitoring yourself. Keep monitoring your progress. So reorient, reset, and analyze on the way. That will get you to the next level. Some of you who may be listening to this video may be wondering, do I have depressive disorder? I feel sad most of the time in the day. Is this depression? Do I need treatment or counseling? So I've listed a few major symptoms of depression. Persistent, pervasive sadness, that is, I feel sad most of the time in the day and most of the days in the week. That is one core symptom of depression. Anergia. Even if I do a little quantity of work, I feel extremely tired. That is anergia. Previously, I used to enjoy watching TV, watching videos, listening to music. All these things don't interest me anymore. That is anhedonia. Lack of pleasure. I used to wake up usually around 7:30. Nowadays I'm waking up around 4 o'clock. 2 hours prior to your usual time of waking up. That happens, that's early morning awakening. There are a few more symptoms of depression, like feeling suicidal, feeling worthless, feeling hopeless, helpless, lack of concentration, decreased self-esteem. If all these symptoms are there for most of the time in the day and most of the days in the week for more than 2 weeks, please consult someone, consult a psychiatrist. You may be having depression, you may not be having as well, but it's good to talk to someone and it's good to consult a psychiatrist. There are some of you or some of your friends who may be feeling suicidal, especially those who are vulnerable to depression or those who have already had depressive disorder in the past. We all are at some point of time feel suicidal in our lives. So whenever you feel suicidal, don't keep things to yourself. Reach out, talk to your friend, talk to your family, tell them you feel like this. Feeling suicidal is normal. Feeling suicidal is natural following a failure or setback. But it has to be managed. It has to be managed by either counseling or medications or family support. Once you feel suicidal, reach out. Don't be afraid. Always our problems can be solved. Always. There is no problem in this world that can't be solved. Okay? So be courageous. Reach out. Reaching out is not a sign of failure or sign of weakness. Please keep this in mind. We all are vulnerable to depression at some point of time in our lives. Okay? Reach out and visit a psychiatrist. If you feel like talking to some helpline number, I have provided a number, which is a helpline number for suicide in India. Talk to them. Reach out. And depression is something that is very common in doctors due to the nature of our job, nature of competition that we have in today's world. Depression is becoming more and more common, and treatment is very, very effective for depression and suicidality. Alright? So that is my message for the day. Whenever you also find your friend or colleague or someone who is suicidal, just tell them, talk to them about suicide. It is a myth that talking about suicide increases the risk of suicide. It actually helps. It actually gives an opportunity for the person who is suicidal to express themselves. All right? Fine. So ultimately, I want to say a few things. Always remember, by becoming an MBBS graduate, you're already a step ahead in the society. Right? PG is just another aspect in a doctor's life. That's it. That opportunity might come at any point of time in your life. It is not mandatory that you should get PG as soon as possible, or only getting a PG is superior to other options. Alright? Always keep that in mind. There are plenty of options to survive as a doctor than just securing PG. Right? The ultimate aim of doctor should be to become a clinician, to help patients, right? So cheer up. This is not the end of the world, right? There are millions of opportunities awaiting you. Reorient, reset, analyze, and keep going. Thank you.